Has someone you love started showing subtle but concerning changes over the past year? Many people assume that death in old age happens suddenly, but the truth is that the body often sends quiet warnings, sometimes months, even a year, before life reaches its final stage. The problem is, most people miss these signs because they seem small at first. It's only later, looking back, that families realize the clues were there all along. But by then, it's too late to prepare, too late to make those last memories count. In this video, we're going to talk about 5 key signs that often appear a year before an elderly person passes away. Some of them might be things you've noticed but brushed off as just aging. Others might seem minor but actually signal the body's gradual decline. Recognizing these signs early gives you the opportunity to provide better care, cherish meaningful moments, and, most importantly, ensure that your loved one's final stage of life is filled with comfort, dignity, and peace. Stay with us until the end, because these 5 signs can help you prepare, emotionally and practically, for what's ahead. When you understand what's happening, you won't be caught off guard. You'll be able to make the most of the time you have left with the people you love. Now let's get started. 1. Significant weight loss. One of the earliest and most telling signs that a person may be approaching the final year of their life is unintentional weight loss. At first, it might seem subtle. A belt that suddenly needs tightening, clothes that appear looser, or a hearty appetite that begins to fade. Many families dismiss it as just part of getting older. But the truth is, losing weight without trying is rarely a good sign. It often indicates that the body is no longer absorbing nutrients efficiently. Muscle mass decreases and essential systems begin to slow down. While some muscle loss is natural with aging, a rapid loss can signal something deeper. The body may be struggling to digest food properly, or it might no longer be able to process protein effectively, leading to muscle wasting. This loss of strength doesn't just make movement more difficult, it increases the risk of falls, weakens the immune system, and leaves the person more vulnerable to infections. Another reason for weight loss is a change in appetite. Many elderly individuals simply don't feel hungry the way they used to. Their sense of taste fades, food becomes less enjoyable, and they may start skipping meals or eating much smaller portions. This isn't just preference, it's a physiological shift. As the body starts shutting down, it stops sending hunger signals to the brain. Underlying medical conditions may also play a role. Chronic illnesses like cancer, heart failure, or kidney disease can all cause weight loss, even before more obvious symptoms appear. Depression and cognitive decline can also lead to reduced appetite and eating, creating a spiral where the body isn't getting enough fuel to sustain itself. Families often try to help by encouraging loved ones to eat more, offering favorite foods, or supplementing with protein drinks. But if the weight continues to drop, it's important to recognize that the issue may not be about food. It may be the body preparing for a deeper transition. At this stage, forcing large meals may not help. Instead, focus on comfort, easy-to-eat foods, and hydration. These can make a bigger difference in maintaining quality of life. If you notice significant weight loss in an elderly loved one, especially if they're eating less, feeling weaker, or struggling to stay active, it's time to pay attention. This isn't just about physical appearance. It's the body sending a message. Understanding that message now can help you prepare for the road ahead, with clarity, compassion, and the ability to make every remaining moment meaningful. Second, extreme fatigue and weakness. One of the most noticeable changes in the year leading up to the end of life is a deep, persistent fatigue that doesn't go away with rest. This isn't just feeling a bit tired after a busy day. It's a profound exhaustion that makes even simple tasks feel overwhelming. Getting out of bed becomes a challenge. Walking across the room takes effort. Activities that were once routine, like cooking, dressing, or even holding a conversation, start to feel too draining. This level of fatigue isn't just a normal part of aging. It's a sign that the body's conserving its remaining energy. As organ function begins to slow, the body prioritizes what's most essential. The heart doesn't pump as efficiently, circulation weakens, and muscles don't receive the oxygen they once did. As a result, many elderly individuals in their final months feel weak, unsteady, and unable to maintain their usual level of activity. This is often accompanied by a general slowdown in metabolism. Instead of using energy to fuel movement, the body shifts toward preservation. This is why someone in decline may start sleeping more, taking longer naps during the day, and finding it harder to stay awake for extended periods. Some may even experience sudden drops in energy, feeling fine one moment and completely drained the next. Perhaps the most heartbreaking part of this process is its emotional toll. Seniors who once took pride in their independence may feel frustrated or embarrassed that they can't do what they used to. They may withdraw from conversations, avoid social interactions, or give up on hobbies, not because they no longer care, but because they simply don't have the energy. This can create a cycle of isolation. As they stop trying, their health may decline more quickly. For families, watching a loved one go from active and engaged to exhausted and withdrawn can be incredibly painful. It's easy to think they're just being lazy or that they should push through it. But forcing activity won't help. What matters most is understanding their limits, allowing them to rest, and making their remaining days as comfortable and peaceful as possible. If your loved one is experiencing deep, ongoing fatigue that isn't relieved by rest, take it as a sign that their body is going through a major transition. This is a time to cherish conversations, create moments of peace, and support them without expectations. In the end, what matters most isn't how much they can do. It's that they feel loved, understood, and at ease. 3. Increased cognitive confusion or withdrawal. As a person approaches the final stage of life, changes in how they think, communicate, and interact with others can become striking. Someone who was once sharp and engaged may begin to forget things more often, struggle to follow conversations, or become disoriented in familiar settings. They may repeat themselves, forget names, or lose track of time, even if they never had memory issues before. These changes aren't just typical forgetfulness. The brain, like any other organ, needs a steady supply of oxygen and nutrients to function properly. As circulation slows, the brain's function declines. You might notice that they become easily confused, have trouble making decisions, or struggle to recognize people and places they've known for years. Some may experience brief moments of clarity followed by sudden episodes of confusion, almost like their mind is fading in and out. Emotional withdrawal is another common sign. People nearing the end of life often lose interest in social interaction. They might speak less, engage less, or sit silently for long periods. Not because they've stopped caring, but because their brain can no longer process emotions and conversations the way it used to. You might also notice mood or behavior changes. Some individuals become irritable, anxious, or easily frustrated. Others seem unusually calm or detached. These shifts aren't just changes in personality. They're often the result of cognitive and emotional adjustments as the body declines. For families, this stage can be especially difficult. Watching a loved one lose touch with reality or pull away emotionally can feel like losing them before they're truly gone. But it's important to remember this isn't something they can control. Instead of trying to bring them back into conversations, meet them where they are. Speak gently. Offer reassurance. Understand that even if they don't always respond, they can still feel your presence. If your loved one is becoming more forgetful, confused, or emotionally distant, don't dismiss it. These are often early signs that the mind and body are preparing for a final transition. This is a time to be patient, cherish quiet moments, and create a calm, familiar environment. Even when words fade, love and comfort can still be deeply felt. Fourth, frequent infections and slow healing. As the body begins to wind down, one of the clearest physical signs is a weakened immune system. You may notice that someone who rarely got sick now seems to catch every cold or infection that goes around. What once were minor illnesses now take much longer to recover from, and small wounds like a simple cut or bruise heal at a noticeably slower rate. These aren't random occurrences. They're signs that the body is no longer able to defend and repair itself the way it once did. One major concern is the increase in repeated infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become more common as immunity declines. Families often think these are just isolated illnesses, but when they start happening frequently or take weeks to resolve, it may signal that the body is losing its ability to fight back. Even antibiotics that once worked quickly might seem less effective now. Your loved one might need stronger medications, longer recovery times, or multiple rounds of treatment. This happens because as circulation slows and organs weaken, The body doesn't respond to treatment the way it used to. Another overlooked concern is chronic wounds. If you notice that bruises, sores, or even small scratches aren't healing properly or keep reopening, it could mean circulation is compromised. Poor blood flow means oxygen and nutrients aren't reaching the skin and tissues efficiently, slowing the healing process. This is why pressure sores, especially in less mobile individuals, become a serious risk. Perhaps what's most surprising is that infections in the elderly don't always present the way we expect. Instead of a high fever, the first warning sign might be increased fatigue, confusion, or a loss of appetite. A sudden mental decline is often one of the earliest indicators of infection in seniors, even before physical symptoms appear. That's why recognizing these subtle changes early can help you respond with comfort and care. For families, watching a loved one go through repeated infections can be frustrating and painful. It's natural to want to fight for more treatment, hoping for one more round of antibiotics or another hospital stay. But at a certain point, the focus may need to shift from trying to cure to providing comfort. Simple acts, keeping their skin clean and moisturized, helping them stay hydrated, and minimizing physical stress, can do more for their well-being than aggressive treatments that may only prolong discomfort. If you're seeing this pattern in someone you care about, pay attention. These signs aren't just about illness. They're the body's way of saying it's time to slow down and focus on peace, comfort, and dignity. Fifth, major changes in breathing or circulation. One of the most telling signs that the body is nearing its final stage is a noticeable change in breathing patterns and circulation. You might observe your loved one breathing more slowly or shallowly. At times, they may pause between breaths or have an irregular pattern, speeding up and slowing down unexpectedly. Some people experience a distinct pattern called Cheney-Stokes respiration, where rapid, deep breaths alternate with long pauses. This pattern might begin subtly, but becomes more noticeable over time. Another major signal is weakened circulation. Hands, feet, ears, or even the nose may feel cold to the touch. The skin might appear pale, bluish, or mottled, especially around the extremities. This happens because the body is redirecting blood flow to vital organs, leaving less for the outer parts of the body. You might also notice increasing shortness of breath. Simple actions like sitting up, speaking, or shifting position may leave them winded. They may begin breathing through their mouth more often or need to pause and catch their breath mid-sentence. Where they once moved around with ease, now just crossing a room might be difficult. Sometimes fluid buildup in the lungs causes a persistent cough, gurgling sounds, or tightness in the chest. These can be mistaken for a common cold or congestion. But in older adults nearing the end of life, it's often a sign that the lungs are no longer functioning as they should. This may also make lying flat uncomfortable, prompting them to sleep propped up with pillows or in a recliner. For loved ones witnessing these changes, it can feel urgent and frightening. You may want to help them breathe more deeply or worry that something sudden is happening. But often, this is simply part of the body's natural slowing down. There may not be a way to reverse these signs, but there are ways to offer comfort. Keeping the room cool, using a humidifier, and offering small sips of water can ease discomfort. In some cases, oxygen therapy or medications can provide relief. But the priority becomes making breathing easier, not necessarily fixing the underlying cause. If you observe changes like labored breathing, cold limbs, or a bluish tint to the skin, recognize these as signals. The body is conserving energy and circulation is slowing. This is a time to be present, to offer reassurance, speak gently, and create an environment of calm and safety. Because in these final weeks or days, the most powerful gift you can offer is not medical intervention. It's dignity, comfort, and the knowledge that your loved one is not alone. Final thoughts. Watching someone you love go through the final stages of life is one of the hardest things any of us will ever face. The changes we've talked about, extreme fatigue, confusion, loss of appetite, frequent infections, and changes in breathing, can be frightening, confusing, and painful to witness. But they're also the body's natural way of preparing for rest. As difficult as it is, understanding these signs can help you shift your focus from fighting the inevitable to offering peace, from fear to compassion, and from trying to fix things to being present in ways that truly matter. This might mean holding their hand more often, speaking softly to reassure them, or simply sitting beside them in silence. These small acts of love, comfort, and presence often mean more than any treatment or medical decision ever could. And if you're the one walking alongside them, whether you're a spouse, a child, a caregiver, or a dear friend, please know this: you don't have to do it alone. Hospice and palliative care teams exist for this very reason. They can guide you, support your loved one, and make sure their final days are as comfortable and meaningful as possible. There is no perfect script for how to say goodbye, but love always finds a way to speak, even when words fail. So if you recognize these signs in someone you care about, take a deep breath. You're not failing them. You're witnessing the sacred final chapter of a well-lived story. Your presence, your tenderness, and your care are the greatest gifts you can offer. You are doing more than enough.